Hip health is paramount to overall health and well-being of your pet. Whether it is evident at a young age or is masked until the pet is older, the pain associated with osteoarthritis of canine hip dysplasia can have debilitating effects on your pet over time. Early detection of hip laxity is the key to delaying the effects of osteoarthritis on your pet as they age, since there is a direct correlation between the two. This early detection can be achieved through the AIS PennHIP procedure. Developed in 1993, the AIS PennHIP procedure can help your veterinarian identify the amount of hip laxity present in your pet's hips. The procedure can be done on patients as young as 16 weeks of age, as well as on older pets. It can be performed on breeding and non-breeding pets, and in conjunction with another anesthetic procedure. By utilizing this method of evaluation, an objective reading of hip joint laxity can be obtained, which allows for a predictive index of the risk of hip dysplasia and osteoarthritis. This predictive index is grounded in 30 years of data based on thousands of dogs in the AIS PennHIP database. The steps of the AIS PennHIP procedure include a thorough consultation with your veterinarian about the specific pre-anesthetic recommendations needed for your pet, administration of anesthesia, and a series of radiographs. These radiographs consist of the hip extended view, which will allow for a general evaluation of the hips, the compression view, which demonstrates how the head of the femurs are fully seated into the acetabulum or hip joint, and finally the distraction view. This view uses a special tool called a distractor that is placed on the hips. This allows the patient to be put into a position that simulates what happens dynamically when running and walking. With the distractor applied, the hips are then in a position where hip laxity can be evaluated. All of the images are performed under the guidance of a professional who has received special training on how to obtain these images and has passed a rigorous certification process to ensure quality radiographs are obtained. Your pet will be able to come home as soon as he or she is fully recovered from anesthesia. The procedure is not painful, nor does it cause any harm or damage to the hips. But if your pet should show signs of any discomfort after the procedure, pain management will be provided. The images are then submitted to Antech Imaging Services for evaluation and analysis. Your pet's hip status, including the distraction index, will be entered into a robust database that will provide information utilized for the assessment of your pet's hip health relative to other breed members. The findings will be reported to your veterinarian. Once your pet's report is received and reviewed, your veterinarian will be able to work with you to determine the future needs of your pet to avoid and delay the negative effects of the osteoarthritis of canine hip dysplasia. AIS PennHIP is more than just a radiographic technique. It's a way to help you and your veterinarian improve the life of your pet through proactive and preventive medicine. AIS PennHIP is all about dogs.